I'm curious. I am curious. Curious.
By nature.
Welcome to Curious by Nature. I'm Jessica Johnson from Newswise. When it comes to parenting, setting boundaries and maintaining discipline is never easy. But what if the way we approach discipline also shapes our children's relationship with food? Research shows that using food as a reward or punishment can create long-term habits that lead to poor nutrition and weight issues later in life. Dr. Susan Woolford from the University of Michigan has been exploring how parenting strategies intersect with childhood obesity, offering insights into how discipline and food choices impact children's health. Our guest this week will discuss parenting, discipline, and the unexpected consequences these choices have on children's eating habits. Dr. Woolford, welcome. Please introduce yourself to our listeners.
Hi, my name is Susan Woolford. I'm a general pediatrician at the University of Michigan, where I also serve as the co-director for the National Poll on Children's Health. I'm curious about ways to help families obtain optimal health and to help them make choices that will allow the children in their families to have long and healthy lives.
Tell me about your work and what you do.
As a faculty member in the Child Health Evaluation and Research Center at the University of Michigan, and I spend much of my time in translational science focused on physician-patient communication.
There was a news release from the University of Michigan Medicine about, I guess, information and data that you got back from parents on a poll. Can you tell me more about that?
Communication is a two-way street, and so part of that work focuses on hearing from parents about their perspectives on issues related to child health. And we ask about a range of topics. And one of our recent surveys asked parents about their opinions on the best ways to discipline children, particularly young children.
What did you find?
So in that study, we found that parents often consult with their child's other parent on best ways to help discipline their children. They also look to friends and family members, and they rely upon resources such as social media and the internet to get ideas on the best ways to discipline their children. We also heard from parents that they sometimes use methods that are not supported by the evidence, such as using threats. Now, we know that threats really don't work very well because quite often families don't follow through with those threats. And so children learn very quickly that they can pretty much ignore them and go on with whatever behavior parents were trying to change. We also found that parents might use certain rewards to help a child correct their behavior. The problem with rewards is that one has to be really quite careful about the types of rewards one uses. So, for example, many parents might use food as a reward. And we really don't believe that food should be used either as a threat, i.e., removing it, or as a reward, because it ends up causing children to have an unhealthy relationship with food.
So you are looking a lot also, in addition to this poll and the information that you got, you're looking at the relationship or how, what effect, let's say, doctors can have on children related to obesity.
Absolutely. So, physicians are faced with an epidemic where millions of children have excess weight. And we all live in an environment that promotes excess weight. And that has long-term detrimental effects for children. We know that when children have excess weight when they are young, they're more likely to become adults with excess weight, which leads to a poorer quality of life and indeed a shorter life. So it's important in childhood to be able to help families adopt healthy lifestyle habits that can set children up for a long and healthy life.
What else do you find within that relationship, and what is effective for doctors to be able to help when they see children that are overweight? What helps to work that maybe also parents can take from that interaction?
So, the American Academy of Pediatrics in 2023 came out with new guidelines for the treatment of children with excess weight. And these guidelines included the recommendation to provide intensive health, behavior, and lifestyle treatment. So, this requires close contact with with providers who focus in on healthy lifestyles for children and frequent visits over the course of 6 to 12 months. Now, these programs are very few and far between, and they require a lot of input from families. They have to turn up at weekly visits, they have to travel, often quite a distance. And so we think that that places a heavy burden on families. And so part of my research is in how do we decrease that burden? How do we enable families to have that frequent contact with their primary care provider or the specialist who works in obesity care, but do so in a way that isn't such a burden? One of the ways that I think we can do this is by using technology. And so, one of the research projects that I'm working on right now that I'm very excited about is developing what we're calling our My Plan program, which is one of these intensive health behavior and lifestyle interventions, but that's delivered completely virtually. So families can participate from their homes. Now, there are few in-person programs, but we know that those that work can make a significant difference in children's health. What we don't know is, will a virtual way of offering such a program be equally as effective or even more so? And so this recent research project that we're just starting out on is designed to try to answer just that question. Can we provide care virtually that will have at least as good and potentially better outcomes? And can we do so while reducing the burden for families?
It sounds like that would be very helpful, right? I mean, it sounds like that would be a great solution for so many people. Is there a research project that you're doing related to this topic?
So, one of the research projects that we recently completed looks at how we can deliver tailored messaging to families to help them make choices in eating venues like fast food restaurants. So many people live in obesogenic environments where there are lots of fast food venues. So saying to somebody, don't go to one, is a sort of a hard thing for them to do. But we thought, well, if you are going to go to a fast food venue, what can we do to encourage you to make the healthiest choices when you're there? So we worked with our partner, MEI Research, to develop an app whereby it would identify when users went into an eating venue, and the app would know where they were, know what time of day it was, know some of the person's preferences, so they could then send messages to the user, either the teen or to their parent, and to encourage them to make a healthy choice. Um, so with that app, we were able to show that we can, in fact, influence what patients buy. Now, the technology is not as good as we would like it to be yet. So it had some challenges knowing exactly when somebody was in the restaurant as opposed to just passing by the restaurant, which of course could have not the impact that you want, because you don't want to tell people about, oh, so there's a fast food venue right nearby. Go in and buy something. So we really have to work to get that aspect of it improved. But it was very promising to know that if those messages were delivered, we could help people make healthier choices.
What would you recommend for people when they're going to a fast food restaurant? You know, they have like the diet options and then they have the other options. Is there something in between that maybe is not the diet, the salad, but also could be healthier?
Absolutely. So, ways in which we can make our meals healthier are really to just tweak them. So, if somebody really is feeling like a big burger with cheese and mayo and all the fixings, it's unlikely that I can persuade them with just a message to go for the healthy salad. However, maybe they could have that big juicy burger with less of the cheese or less of the mayo. And any, even small changes, if they're practiced consistently, can make a difference. In one of our research projects, we asked children what would help them make those changes. And one of my favorite quotes from one of our participants was, "You have to tell me why I should have a dry burger." And so, in part of our messaging, we'll explain some of why that they will have fewer calories or fewer grams of fat, or this will help to improve their metabolism. So we try to give them some little reason why. And we don't want to have children focus on counting calories or counting nutrients in their food, but we do want them to know the benefits of what they're eating so that they can know what they're consuming is helping their body versus taking in things that are going to be detrimental to their health.
Well, that is kind of going back to what the poll says also, that there are threats or, I'll take away your screen time, or I'll take away, you can't have dessert if you don't do this or that, or for discipline. In a way, those maybe don't work because the child doesn't really know why and isn't convinced as to why he shouldn't have that behavior. And so what that child told you was very interesting in terms of being able to understand the real reason, and that it's then not a punishment, but a decision, I guess.
Absolutely. I think understanding why we should do something versus the other. If we think about discipline, if we think about how we eat, if we think about many of the things that we do in raising children, it's about teaching. So discipline is about teaching. You want that child to learn the best way to manage their emotions and the best way to make choices as they go throughout their day. And we have a very short period with children while they're young to and help them to learn the ways to do this. And so it's not about punishing them or trying to hurt them. It's about trying to help them learn the best ways to make healthy choices, both about their behavior, the management of their emotions, and as it relates to healthy weight, their activity, their nutrition, their sleep. One of the areas in which families have lots of challenges is around sleep, when children don't want to go to sleep. And adolescents these days rarely get enough sleep. And I find that when children are in the office and I can explain to them that by getting enough sleep, it helps to control those hormones in their bodies, one called ghrelin. It's a gremlin that helps to make you want to eat. But if you sleep enough, that gremlin, the ghrelin, goes to sleep, you get less of it, and you're able to not be as hungry all the time and to make healthier choices. Now they have an understanding of why somebody wants them to go to sleep. And it's not just trying to control them.
Not just telling people what to do, even if you think you have been used to telling people your children because they're so young, you just have to tell them what to do. But it isn't, that's a real shift in understanding, right? Of what maybe sometimes people think of as parenting is just directing instead of teaching.
Parents are their children's first teachers and most important teachers. And so they have a very challenging but very rewarding position in their child's lives.
So Tom has a question that he posted, and it says, is it harmful if parents take their children out for fast food as a reward for behaving well or to celebrate an achievement like food grades or after a soccer game?
I'm so glad you asked that question about rewards, because we really do not want to use food as a reward. Even if it's fast food or highly processed foods, ice creams, cakes, all of those kinds of things that we typically use for rewards, they will encourage children to have a preference for that, and it will be harder for them to want a healthier intake. So when one is celebrating, it's best to find another way to celebrate. So take them out to do something fun, purchase them something that they like a book or um, an activity that they enjoy. Or quite often, children like rewards of spending time with the people who are most important in their lives. So that can be used as a reward. But if we can avoid food as a reward, that really would be best.
For example, you were talking about obesity and learning different ways and learning how to eat healthy. But if a child is in a family where the parents are obese, that's very different and it's very difficult to do. So, how would that work?
So you raise an excellent point of the parent's role in this process. Now, when children are young, when we think about their risk of having excess weight as they get older, more important than that child's actual weight at that time is actually their parents' BMI. So if parents have a higher BMI, then it's more likely that the child will too. Now, there's nothing that parents can do about their genes, and there's nothing that the child can do about their genes. But there are things that families can do if they have a propensity to have excess weight.
How did you get into this field of research in terms of obesity and um, and the physician-patient experience?
So, I have always been very excited about pediatrics because you can make a change in a child's life when they're very young, and it can pay dividends for decades. And so, I've always thought it's really important to try to make a difference in the lives of children. And when I was in primary care, solely when I first came out of residency, I remember thinking that, oh, I've been trained in a lot to do with physician-patient communication, and I feel like I am interested in the whole person, and I spend time with my parents and their children, and yet I noticed that a lot of the babies that I started caring for when they were newborns, and now I have them at 5 and 10 years of age, and they have excess weight. And I thought, oh dear, I'm doing a terrible job. And so I then realized it wasn't just that I was doing a terrible job, but that indeed, as a healthcare system, we really weren't doing terribly well in this space. And actually, as a society, we were not doing very well in this space. And so I decided at that time to go back and do extra training and did a fellowship in health services research and a master's in public health, looking at health behavior and health education, and ultimately another board certification in lifestyle medicine to be able to make a difference in this space because obesity affects so many other areas of our health that if we can just change this, we can really help children to have the healthiest life possible.
And what is the future of childhood obesity?
Well, there are lots of changes in this area at the moment. In those guidelines I mentioned from the American Academy of Pediatrics, they included a discussion about the use of medications. Now, we've done bariatric surgery in adolescents for many years and seen the ways in which that can be helpful, but we really didn't have many medications that we could use in the past. Now, of course, we have these GLP receptor agonists, and they have gained a lot of attention, and they are approved down to age 12 in children. And so I imagine that this is going to change the landscape quite a bit.
When were they approved?
So they've been approved as early as 2020. Now, prior to that, they were used for the treatment of diabetes, but they've now, in recent years, been approved for use in weight management specifically. We've had other medications that have been possible to use in children, but they weren't very effective. And as I say, very few of them. In fact, one caused so many side effects that very few kids would actually want to use it. But these new medications are easy to tolerate, have few side effects, and appear to be quite effective. But there is a downside. And the downside is that they seem to work when you take them, but do not work once you come off of them. And so the question is, does one want to suggest that children should be on a medication for the rest of their lives in order to have a healthy weight? And I would suggest that that might not be optimal. That what hopefully we can do is use these medications as an adjunct to lifestyle interventions, and that children will be able to gain those lifestyle habits that they will need in the long run. And so that it will be possible to have them come off of these medications and still maintain a healthy weight.
We had at Newswise a recent news release from, I think, CU Boulder about this microorganism called Mycobacterium vaccae, and how that could be the basis of a obesity vaccine. And it's basically this microorganism found in soil and also, I guess, milk, maybe non-pasteurized milk or something like that. And that once it has been given to animals, they do not gain weight from sugar or fatty foods. Have you heard of this? I don't know.
I think there is a lot of research out there about ways in which we can address the problem of obesity because it is such an important issue for us to be able to reverse. Many of these ideas may or may not pan out when we try to implement them in humans, but you have to start with a lot of different ideas, and one has to be quite creative in order to address the problem. Um, while those types of interventions might be quite far off, I think there are lifestyle interventions that are maybe not quite so far away. For example, using AI in the treatment of obesity. So we can do this in many ways. AI in the used in apps could, for example, identify when we are stressed, as it hears us talk into our cell phone. It hears the tone of our voice and the words that we use. We could then say, "Oh, this person is stressed," and automatically send them a tailored message that will help them engage in a healthy way to address their stress rather than stress eating. I think AI can be used in other ways as well. And maybe those might be approaches that can help with excess weight sooner than we might reach a obesity vaccine.
Thank you so much, Dr. Woolford. It was a great conversation.
Curious by Nature is a production of Newswise. More than 7,000 journalists get the Newswise wires. Visit newswise.com and find out how to spread your news today.